Good morning. If folks could please take their seats, I think we'll get started. My name is Paul Pronik. I'm the Deputy Director of the Global Health Institute at Sing Health, Duke-NUS. Welcome to Day 4 of the World One Health Congress. We have an exciting lineup for you today. I think yesterday for me was really interesting, and as well as Tuesday, because we talked about issues of policy and system reform, and just some of the challenges that are involved in really trying to make One Health actionable. And we all know that at the end of the day, a lot of this comes down to finances. So our first couple of speakers are going to talk about international finance as well as philanthropic finance. Our first speaker is from the World Bank. Her name is Manuela Ferro, and she is the World Bank's Director for East Asia and the Pacific region. She's going to be giving us about a 15-minute pre-recorded video, but then we're going to have a live Q&A with Martin van Nieuwkoop, who's the Global Director for Food and Agriculture from the bank. So looking forward to a rich session, and thanks very much. Over to Manuela.
Distinguished guests, colleagues, ladies and gentlemen, a very good morning. It is a great pleasure and an honor to address you today on behalf of the World Bank at the 7th One Health Congress. I want to thank the Congress organizers for the kind invitation extended to us. Epidemics and pandemics can exact tremendous health, economic, and social costs on individuals, on their communities, on nations, and on the global economy. They often affect the poor and the vulnerable and other vulnerable groups disproportionately, increase inequality, and threaten development progress. In East Asia and the Pacific, the region that I lead at the World Bank, COVID-19 stopped progress in poverty reduction for the first time in 2 decades. We estimate that 32 million people in the region were unable to escape poverty as a result of this pandemic. Direct economic losses from COVID-19 are estimated in the trillions of dollars globally. Major outbreaks are not only disruptive and costly, but they are also becoming more frequent. The world is witnessing an increasing trend in public health threats, with the number of emerging infectious diseases outbreaks growing steadily to several hundred every year since 2000. As we speak, the next pandemic may already be on the horizon, and the root cause of many of these outbreaks is fundamental to the One Health approach. About 75% of all emerging infectious diseases and almost all known pandemics are zoonoses. In other words, they cross over from animals to people. And disease emergence also is created by human activities that change our natural environment and increase contact between wildlife, livestock, and people. HIV/AIDS, plague, Nipah virus, SARS, HPAY, Ebola virus, all of these are examples of recent infectious diseases that emerged in the human, animal, and ecosystem interfaces. The human costs have been staggering. Globally, HIV/AIDS alone has caused 40 million deaths so far. There are many drivers of emerging infectious diseases. These include wildlife trade and farming, deforestation and habitat degradation, biodiversity loss, intensification of livestock production, and poor food marketing systems. An additional driver of growing concern is climate change. Climate-induced changes in land cover and land use and more extreme weather events may impact ecosystems and increase disease threats. East and South Asia are known for global hotspots of infectious disease emergence. This is due to a combination of high population density, livestock production, wildlife abundance, high levels of land use changes, deforestation, and habitat fragmentation. epidemics and pandemics are occurring and reoccurring, causing a prolonged cycle of panic and neglect. The increased attention given to emerging infectious diseases at the onset of any single event fades as the outbreak is brought under control, and investments in prevention and preparedness wane as a result. All of us here know that this is not sustainable, and the cost of inaction is very high. It is paramount to break this cycle, and we need to move away from a focus on reactive investments towards pandemic preparedness and pandemic prevention. Prevention to lower the risk of spillovers from animals to humans and stopping emerging diseases at the source. And preparedness to reduce the costs of the outbreaks through early detection and rapid response. Together with the WHO, the World Bank estimates that the global cost of preparedness would be around $31 billion annually, while the cost of prevention would be between 10.3 and 11.5 billion per year. There's a strong economic case for investing in pandemic prevention. The cost of prevention is a third of the cost of preparedness, and less than 1% of the cost to respond to a pandemic like COVID. In addition, investments in prevention de-risk investments in preparedness and reduce the cost of the response. Investing in prevention at source is particularly cost-effective when optimizing existing investments in conservation of biodiversity, reduction in deforestation, and reduction in forest fragmentation, and transformation of food systems and public health services. Such investments also bring many co-benefits, such as climate change mitigation and adaptation, environmental services, food safety, and reduction of food loss and waste. Aligning incentives to cover these costs, however, is a challenge. The benefits of preventing pandemics accrue at the national and global levels, while the costs involved in reducing risk are mainly borne locally. Investments in prevention have also been neglected because, when successful, many of these benefits are invisible. And even so, investments in pandemic prevention and preparedness can deliver benefits that can be felt locally, nationally, and globally, and are therefore recognized as a global public good that also contributes to local health security priorities. And this leads us to the topic of this Congress, One Health. Years of experience have shown us that investments in prevention and preparedness should be guided by an integrated One Health multi-sectoral approach that aims to sustainably balance the health of people, animals, and ecosystems, focuses on geographic locations with higher risks of spillovers at the human-animal ecosystem interfaces, and reduces the risk of spillovers from forests to farms to sprawling urban areas. This multi-sectoral approach has been demonstrated successfully in East Asia and the Pacific. For example, the emergence of the Nipah virus in Malaysia in 1998-99 occurred when pig farms and fruit orchards were placed at the edge of forests and fruit bat habitat, resulting in animal to human disease transmission. Detecting this transmission chain required the collaboration between experts from forestry, wildlife, veterinary, and human health. And this, in turn, led Malaysia and Thailand to institute a policy of distancing fruit orchards and pig production, ramping up surveillance programs, and identifying areas at high risk of disease spillover. It has also led to intensive extension services and outreach. Malaysia's experience can be considered a good One Health example. However, what we see today is that existing spending on global health security is prioritizing reactive responses to the current emergency. To prevent future pandemics, we also need to take greater action at the source, strengthening wildlife and animal health systems. We need a paradigm shift in how we manage and interact with our natural and built environments. The main drivers of emerging infectious diseases are linked to increasing human impact on our environment that is occurring on a profound scale, often threatening human, animal, and environmental health in ways that are unique in history. At the World Bank, we see the One Health approach as a chain composed of many disciplines that we embrace with each other. We work on each link in the chain as well as in their interlinkages. Currently, wildlife and animal health systems are amongst the weakest links, with limited attention and financing. We need to safely manage multiple interactions between wildlife, domestic animals, humans, and ecosystems in a holistic way. These are areas where increased attention and resources are sorely needed. One Health requires financing at the international level, where there is a need to invest in regional disease surveillance and control programs, transboundary animal disease and wildlife health programs, safety standards, and trade protocols. At the local level, more financing is needed for reducing and better managing the interactions between humans, animals, and our environment. This would require adapting and adjusting existing commitments and policies and taking into consideration prevention and pandemic risk reduction. Key elements of pandemic prevention will be less costly if we can identify and improve prevention-oriented policies that are already being implemented, but that lack pandemic prevention considerations. Multiple opportunities exist to mainstream this One Health approach into ongoing projects and programs, and I encourage you all to explore them. We also need strong political and technical leadership to successfully implement the One Health agenda. For example, to establish clear mandates with well-defined roles and responsibilities for different ministries, such as agriculture, environment, health, transport, and commerce, and effective mechanisms to coordinate prevention and response actions. There is an important role for technical agencies and financial institutions to coordinate global, regional, and local activities to the public sector, the private sector, and civil society. A One Health investment framework needs to be adopted and implemented at the country level and align with each country's national action plans, risk factors for emergency diseases, and existing resources and programs. Doing so successfully would require removing the obstacles to prevention, such as insufficient funding or research capabilities, financing prevention as a shared responsibility, and ensuring country ownership and enabling institutional environments. At the World Bank, we have a long track record of investments in One Health. The OCP program started in 1970, combining health and environmental interventions to curb river blindness in partnership with the WHO. The Global Program for Avian Influenza Control and Human Pandemic Preparedness and Response in the 2000s coordinated public and health and veterinary services in partnership with WHO, FAO, and the World Organization for Animal Health. And the Regional Disease Surveillance Systems Enhancement Program in Africa, launched in response to Ebola, to build integrated surveillance systems for animal and human populations. Today, we have over $1.5 billion in commitments in more than 40 projects around the world. Building upon prior commitments, pandemic preparedness was incorporated in IDA 18, carried into IDA 19, and features prominently in IDA 20. IDA is the fund of the World Bank, that funds the poorest countries in the world. The human capital theme in IDA 20 proposes a policy commitment to strengthen health security by improving pandemic preparedness and prevention at the nexus of human, animal, and ecosystem health, including zoonotic diseases and antimicrobial resistance. The World Bank, together with the WHO and other development partners, has also established a new financial intermediary fund for pandemic preparedness, prevention, and response. This mechanism is expected to finance critical investments at the national, regional, and global levels with a focus on low and middle-income countries. The fund is expected to announce its first call for proposals in late 2022 and early next calendar year. And we at the bank will complement its use with World Bank resources. We have also produced influential documents and analytics on One Health, including the One Health operational framework, and more recently, a report on COVID-19 and climate-smart healthcare that incorporates One Health considerations, amongst others. As I conclude my remarks, I would like to offer 3 key takeaways. First, we need a paradigm shift on how we address pandemic challenges. As the world faces more frequent health crises, countries urgently need to build stronger, more integrated One Health systems that are resilient to future events, including pandemics. Pandemic prevention is a global public good. No country should be excluded from benefiting from prevention, and there's no limit to how many countries can benefit. We need to work together on One Health so that we may all benefit. Successful implementation of One Health requires also improved coordination, communication, and collaboration between sectors, reinforced by capacity building. Investing in One Health is the best way forward to break the cycle of panic and neglect, once and for all. If we fail to act now, we will be like Sisyphus, doomed to forever roll a boulder uphill to manage the response to the next pandemic. At the World Bank, we stand ready to continue working with all partners on this agenda, and I wish you a successful and productive Congress. Thank you.